Most people don't realize that 100 years ago, the leading cause of death in the United States was tuberculosis, TB. But by the 1970s, TB was eliminated from the United States. Back in 1987, Oprah Winfrey talked about HIV and AIDS and predicted that 1 in 5 Americans would die from the disease. Today, it's treated like a chronic disease in the U.S.
CDC works 24/7 protecting Americans from threats. Whether those threats come from this country or anywhere in the world, whether they're infectious or non-communicable, whether they're intentional man-made or naturally occurring.
By focusing on all of us, CDC has helped each of us.
When our country tries to estimate the economic cost of life-threatening diseases, they dramatically underestimate the true cost, the emotional effect on the family and friends, what's occurring in the workplace as you're dealing with this disease. That is why the CDC efforts in the community are so important. They reduce the effects of cancer, heart disease, and diabetes.
Tobacco causes 440,000 deaths in the United States every year. It is the #1 cause of preventable deaths in the U.S. CDC is the lead federal agency in comprehensive tobacco control and prevention. We really work to support state programs so they're effective. And the Tobacco Laboratory, we're able to measure both the addictive substances and the toxic substances in tobacco products and in tobacco smoke and in people. We're able to figure out what are the things that are causing such high rates of disease and death.
We don't know what the future will bring, but the reason I'm so focused on public health and the work of the CDC is the scientific research and data and capabilities of the Centers for Disease Control will enable us to deal with those life-threatening diseases, whatever they might be.
Fundamentally, we have one and only one goal: helping people live longer, saving lives. The bottom line for me is, how many lives did we save?